But if things don't straighten out in the next month or two, then I think we're heading for a serious drug shortage. If you were to assume and presume that this is a contagion, or that that this is a disease that is going to really spread through human contact, then obviously mass gatherings should be avoided. And this is what the world is doing. I mean, basically, even there's a threat of the Olympics being cancelled. Please, let's not panic. Let's keep our hopes alive, because I really hope this will pass in a few months.
Our newsmaker on the program today is respected business leader and the head of Biocon, Kiran Shaw, at a time when India has suspended all tourist visas and is waking up to the gravity of the coronavirus challenge, a virus that could grow exponentially and about which doctors say till there is a vaccine, social distancing may well be the only cure or the only approach. Now, coronavirus will have many impacts. It will hit the pharmaceutical industry, it will hit the economy, and it will also hit how we work and interact with each other. Let's bring in Kiran Shaw into this critically important conversation. Welcome to the program, Kiran. What is your own assessment, your expert opinion on what it's looking like in India and globally? How bad is it?
Well, Barkha, as you know, the WHO has basically called it a pandemic. And it is very worrying to see the kind of spread of coronavirus across the world. And of course, this has been compounded with the kind of global travel that we see these days. And what is really worrying is also the spread and the very rapid spread of this virus in Europe, where they don't have any closed borders. And that makes it even more difficult, because you can basically screen passengers at an airport, but how many people are you going to start preventing from entering your borders when it's on land and rail? So I think these are very, very difficult times that the world is facing. And it is crazy to think that something as microscopic as a virus is bringing the world to a halt.
Yeah. Yeah. I want to ask you specifically to talk about the drugs availability situation in India, Kiran, because I read a report by a Hong Kong-based firm that actually said that by middle of March, India could be looking at a shortage of drugs, not related to the coronavirus, but other drugs like non-steroid inflammatory drugs, HIV drugs, and so on, because of the dependency on the bulk drugs ingredients from China. And since China has been so badly hit, so will India pharmaceutical be. So how do you see this prospect or this very alarming report of a possible drug shortage? Some are saying by middle of March.
Well, there are two aspects to this. One is that China itself seems to have brought the coronavirus spread under control. And I'm told that, many of these regions which are really producing some of these drug intermediates which we are so dependent on are basically limping back to business. I'm told that 2/3 of China's workforce that was quarantined or, staying out of work are back to work. And I'm told that by the end of March or mid-April, China at least has indicated that it will be almost back to normal in terms of its working population. So we have to really wait for all this to happen and see whether this is true or not. Now, I think when it comes to the dependence on China, I think the world is worried about is really the shortage that we can see in terms of antibiotics, because that's where I think the world is really dependent on China. India is certainly very dependent on China, both for antibiotics and for drug intermediates. And as I said, if China is indeed limping back to normalcy, then I don't think we will see such a major impact. But if things don't straighten out in the next month or two, then I think we're heading for a serious drug shortage.
Now, Kiran, you, among other leaders of your industry, have been talking to the government about this prospect, and we hope it doesn't happen. We hope things in China improve and we do not face a drug shortage. But if it happens, what do we do? Because look at the statistics. India's drug makers import 70% of bulk drug requirements from China. $10 billion in imports. You know these figures just for the benefit of our viewers. If China is not able to bring this under control and resume API production, what happens to antibiotics? What happens to the drugs that millions of Indians need and use?
So I think, we did have a discussion at an industry level. And one of the things that we would like to do is to see how quickly we can actually make some of these drug intermediates, because, we do have the capabilities, we do have the plants. And now that a number of plants are actually working to quite a high idle capacity, I think this is the time to bring back a number of these drug intermediates to India. I think this is also a time for us to think about, sort of reviving this whole antibiotic production in India. As you know, all of them are kind of mothballed, but we need to bring back antibiotic production to India. So this is actually a time of crisis where India needs to de-risk its dependence on China. The world also needs to de-risk its dependence on China by ensuring that countries like India also are a second source.
So is this in these dark clouds, could the silver lining be a revival or an opportunity to revive the Indian API market? API, of course, being active pharmaceutical ingredients. And what should the government do to incentivize this, to not block it with permissions and difficulty in getting credit and so on? What would you expect the government to do at this point?
Well, I certainly believe that, the Indian government has already come up with a very important fiscal incentive for manufacturing, for the manufacturing sector. They've actually, offered a 15% corporate tax rate for new manufacturing entities. I think they should extend this 15% incentive to even brownfield projects and capacity expansion that existing companies might be willing to invest in. And I also believe that the government needs to look at actually extending more incentives, more credit to the pharmaceutical industry for such expansions, with a sort of a slightly liberal payback terms, which would incentivize companies into in making these important investments. I think I've always said that the Indian pharmaceutical industry is an unsung hero, because although it is acknowledged to be the pharmacy of the world, I think it has received very little fiscal support from various governments. It's not about today, but it has not received the kind of fiscal support it should receive in terms of the weighted average tax reduction that has been accorded to the pharmaceutical industry from the government over time. And now there's a proposal to actually bring about a closure on this incentive, which I think is a bad idea. I think the Indian pharma sector must invest in R&D, and that R&D is only going to basically expand the sector. And it is so vital that it needs this particular tax reduction in order to keep increasing R&D investment. Without that, this industry is not being supported. That to me are those are some of the important incentives and support that the government must provide to this sector.
Now, I want to push you a bit on the drug shortages, because that's the kind of elementary thing that every Indian cares about. I think Indians would be alarmed to know, because ordinary citizens don't know that so much of our drug industry is dependent on Chinese imports. Kiran, if we hope this doesn't happen, but if we are looking at drug shortages, you're talking about a 1 month to 2 month timeline. Can Indian pharma companies roll out something indigenous and independent in that time period, which is not dependent on bulk drug imports from China?
Well, I personally believe that the crisis that we are facing today should not go beyond a few months. And if that is the premise, then I don't think we are going to face the kind of drug shortage that everyone is worrying about. Somehow I feel that with the kind of measures that are being taken around the world, we will see some semblance of normalcy limping back in the next few months. And until then, I think there will be a lot of concern, a lot of alarm. But look, if it's going to happen in the next, 6 months and we can't find an answer to coronavirus, sure, it's going to not just be a problem for India, it's going to be a global crisis because the whole world depends on China for many of these critical essential medicines.
Yeah. Uh, there are also other hits. One is, of course, to drugs, which you've spoken extensively about. But what about the hit to the economy? I have before me a figure from ADB. The ADB Bank, Kiran, is predicting a global GDP slowdown of 0.4%. And that's a conservative estimate. As a business leader, how are you assessing the hit to the economy globally and within India?
Well, you can already see how the global economy is hit. The airlines industry is one of the worst hit, right? And of course the kind of the cascading effect it has on tourism in and in business in general. I mean, if you are not able to travel because of this travel ban, you can see that all businesses are going to be hit except maybe the kind of IT services business. But then if you're also finding that quarantining is going to be the order of the day, then you're going to see well, the regular businesses will definitely get affected. Maybe a new kind of opportunity will arise in terms of online retailing, in terms of everything which does not involve people to come out and either go for shopping or but many sectors are going to suffer very badly. And if you find that even the logistics is going to get affected because of some kind of quarantine, which I hope it doesn't, then it has a huge impact overall. Because how do we export our products? How do we import products? Then it brings the whole world economy to a grinding halt. I don't think it will come to such a catastrophe.
I hope you're right, but you did make the point about a wake-up call, around the dependency of even India on Chinese imports. What are the other sectors that you see worst hit by this absence of Chinese imports at this moment till China regularizes and gets back to normal? Or do you see an opportunity in some odd way from these tough times for Indian industry? Which way do you read it?
Well, Barkha, if you look at it, today it has gone beyond China, right? I mean, today, if you look at the epicenter, it's moving. I mean, you've got Italy now at the epicenter of the coronavirus. Korea has been badly hit. You're seeing now Europe is slowly sort of expanding. You've got Germany, France, all these countries seem to be, prepared for the worst. You're seeing the US preparing for the worst. So, there's no short answer to what you're asking me for because it's not just about China. I think, yes, I think every country has to understand that it can have a huge impact. But if I look at India, I think India has an opportunity to keep expanding certain sectors. We have a very large pharmaceutical sector. And knowing that we are at risk because of our dependency, I think we should take some action on this front. That's why I go back to saying that we can actually make it into an opportunity and we can actually make ourselves vertically integrated in terms of pharmaceutical manufacturing. And I think that will strengthen us and that will even strengthen our position in terms of the global opportunity that the pharmaceutical industry presents to us at this point in time. As far as my own biopharma sector is concerned, I'm pleased that we don't have this kind of dependency on any country for that matter, because most of it is indigenously available. But having said that, yes, there are some parts of the devices and things that we are dependent on other parts, not China necessarily. So I think from that point of view, we are a bit insulated from the China problem.
Yeah.
And I hope that, but from a logistics point of view, I hope that we don't see our exports being curtailed because of any kind of transport ban. So these are the things to watch out for. As far as our IT sector is concerned, since they are not dependent on anything except talent based in India who can anyway sit here and work out software solutions for the world, I don't think that sector is going to suffer very badly. But anything that needs importation, exportation, logistics, will have to start looking at the risks involved.
How far do you believe, because I know you're an expert in this area and you have followed the science of this very closely, how far do you believe the world is from a possible vaccine? And do you think this will once and for all end the debate around vaccines? Because, for example, there's a flu vaccine and many people don't even know about it. Those who know about it don't bother to take it. Is this going to change our attitude to vaccines finally, if and when, or as and when a coronavirus vaccine comes?
This is another very important point that you have raised, Barkha, because I think, again, we need to look at this crisis in seeing the way we manage our own public health. Okay. I think vaccines and immunization in general is a huge need for the world. And I think India is very strong in vaccine production. And I think what we are doing very suboptimally in this country is vaccinating our population against even the common flu. I know that I take a flu shot every year, but I don't see any of my friends doing that. And I think this must start becoming mandatory. And I think these are the kind of efforts that will actually make our populations more healthy and less vulnerable to such epidemics. I think we also need to focus a lot on investing in virology, in investing in the National Institute of Virology, ensuring that we have rapid response in terms of diagnostics. We have rapid response in terms of vaccine development. Now, the problem with vaccine development is, Barkha, the need to validate the vaccines that we're developing from a safety and efficacy point of view, which you have to address through clinical trials. And you just cannot shorten that particular regulatory pathway. And therefore, it takes a minimum of a year to 18 months before you can get a vaccine released to the market. So, people who participate in clinical trials of vaccines will benefit from the vaccine itself. But, before a larger population can benefit from it, it takes that kind of time. On the other hand, you're also talking about what do you do with people who already have the COVID-19 virus in them, infected, with which they're infected. And there, I think you're seeing some of the antiretrovirals are being effective. We also need to really focus on the use of AI in very quickly mining all the kind of chemical libraries we have to come up with a rapid response to what could probably work against any other viral threat. So I think there's lots to be done in this whole area of virally borne diseases, and also the whole area of viruses, understanding viruses, because viruses are being used in very different ways. Of course, you need to find antivirals. You need to viruses are being used as viral vectors for cell therapy, for gene therapy. And I think we are not doing enough in this area. I think India needs to invest a huge amount in beefing up our knowledge and scientific understanding of this whole area of virology. So I think we need to invest at least $1 billion in the whole area of biological sciences, not just viruses, but bacteria as well, because microbiology itself is going to become a very, very important scientific need for the world. And I think this is where India must focus. We already have a lot of strengths. I think we are, lucky to have a large number of biological scientists, and we must leverage that talent. And we must start really seriously focusing on some of these areas. We have developed the National Institute of Virology. and many other such institutes that understand microbiological sciences. But we are not doing enough to beef them up and make them centers of excellence in terms of global centers of excellence.
Yeah.
So I think this is where I would really like to see more investments done. And now actually the world is realizing that it cannot afford to turn a blind eye to what it used to consider the diseases of the developing world.
Right.
The communicable diseases today are now not just confined to the developing world, but it is a global health problem.
Oh, yes. I mean, you look at the fact that Italy and Europe, in fact, is struggling in a way that even India isn't at this moment. And hopefully this will be a wake-up call. But Kiran, I have a question for you. There is a lot of debate among ordinary people over the use of homeopathy. A crisis like this often encourages non-scientific responses, panic responses, the need to embrace placebos. And we see people lining up to buy homeopathic medicines at this point, like they were initially lining up to buy masks, till doctors actually had to come out and say that let the masks be for health practitioners or if you're actually impacted by the virus or a cough and cold yourself. Where do you come in on the homeopathy debate? Because I've seen so many people in Delhi, where I'm sitting right now, make a rush and a beeline for these homeopathic medicines.
Well, let's put it this way. Zinc is known to have an effect on, our, ability to fight these kind of infections. We know that, for instance, Ayurveda is a holistic way of looking at the immune system's ability to fight invading antigens and so on and so forth. So I think, yes, I think this kind of an epidemic, you can't fight it with homeopathy and Ayurveda on its own, because you do need a much more targeted approach, like the antivirals, you need vaccines, you need all these things. But, what can you say to people who believe that these things are helping them? And you're right, many of these things have a placebo effect. As a scientist, as someone who believes that you need a targeted approach, I would not put so much faith in these other remedies. But then at these times, if you add these to what you're already doing, it might help.
Yeah, but not as a standalone treatment. I want to ask you, we've all seen how a big part of the world is having to shut down. And the top trend on Twitter today is hashtag cancel everything, and how social distancing might be the only thing that can work. Do you believe that India must cancel, or I would say postpone, the IPL? Because that's the one decision that hasn't taken. We've sealed our borders to tourists, even held OCI visitors in abeyance, but we haven't announced a postponement of a mass gathering like the IPL. Where would you come in as a scientist on that?
Well, if you were to assume and presume that this is a contagion, or that that this is a disease that is going to really spread through human contact, then obviously mass gatherings should be avoided. And this is what the world is doing. I mean, basically, even there's a threat of the Olympics being cancelled. So I think you have to take these things very seriously. I think more than anything else, Barkha, we in India need to really track this disease very carefully. We need to make sure that we actually track all these infected people in India, how quickly they're recovering, and we really need to understand, is it spreading or not? And this is an opportunity for us to know how fast it is spreading, whether the weather has anything to do with the curtailing its spread, whether the groups that it is attacking are doing poorly or well. All this kind of data has to be generated. We can't simply look at people who are affected and who's coming out and who's staying in. I think we need to use this as a much more important opportunity to do epidemiology based research across the world. So I think this is a time when we have to look at all this data. If we find that it is not spreading, if we find that it is contained and that most of the infected people have not spread it beyond their quarantined bit, their families, their immediate families, I think it's important for us to use that kind of data and start sort of calming the panic that is existing today. So I really can't make statements beyond what the WHO is warning us about, because obviously they're very concerned about the spread. And it seems to be spreading quite fast in countries like Italy. If it could do that in Italy, why not in India? And that's why I think we have to be very careful. So I think containment and this whole approach of, curtailing social impact or socializing is very, very important.
One last question: how did you find the screening process at the airport? I know you came in recently into Bengaluru, and you tweeted a little bit about it. If you can talk about what's happening in terms of screening people at airports, how it could be better or different, that's one question. And the other question is, right now only government facilities are allowed to test for coronavirus. So there's a huge burden on government hospitals and government facilities to do these tests. Doesn't the private sector have to be enlisted in this process? So both the screening process and the role of the private sector, Kiran.
So I was quite impressed with the way the airports were handling at least the temperature profiling. Okay, so every passenger was checked for their temperature very rapidly, very efficiently. I was very impressed with that. I just felt that the form filling was a bit tedious, cumbersome, and the forms themselves were very badly drafted, because I think they were, scripted by somebody who is from the old world, because it referred to district, town, tehsil, and things like that. So I just felt that, we should use a lot more. And I saw that the people were just sort of shelving those pieces of paper by just looking at what you had signed. And, I really don't think that's the way we should be doing it. We should be collecting data digitally. That's what I would have liked. So I think, being able to record data digitally, which you can then use to profile the patients who have, the passengers who have come in, how many of those passengers had elevated or raised temperatures, what was the age of that passenger, did any of them get quarantined, did any of them come out positive? Those are the kind of things we have to be very careful about. But one good thing in India is that I know that one of my colleagues just arrived from the US yesterday, and he was immediate. And as a company policy, we've asked him to, quarantine for 2 weeks. I think these are some of the things that all corporations and are trying to sort of, have as a policy, which will actually help the process to come.
So you're saying you asked him to be you're saying you asked him to be quarantined even though he did not test for corona as a safety measure.
At home. These are all self-quarantining policies that every company has started adopting, saying that if you've come from anywhere in the world and you've come to India, and if you come from any regions which are especially highly prone to the coronavirus, which is really now most of the world. I think we've just insisted that everyone self-quarantines for 2 weeks, so that if in case they show any signs of the coronavirus during that time, then you can quickly address it.
But does testing have to go beyond government facilities? How will government facilities alone cope with that?
To answer your second question, I certainly believe that there needs to be a capacity building exercise very rapidly, because I think government testing can only do so much. They need to reach out to private sector who can actually quickly help to expand this capacity. I know that our own company, Syngene, is in a position to offer this kind of service of testing. We would gladly partner with the government to expand the capacity. They need to reach out. There are many labs in the country who are willing to do this. We are already beginning to basically look at very rapid screening kind of protocols. For instance, the CDC has actually put out the sequence of the COVID-19 virus. And based on that, we can quickly develop PCR-based tests, which are very rapid. They may not be, on par with the kind of WHO kits that are being used to test for COVID-19 viruses. But I think we can do a quick check on whether you have that virus or not. And then you can confirm it using those other tests. So there are various approaches because we do need to do screening very rapidly. I mean, if, for instance, you could do a quick screening at the airport with all these arrivals, and face it, most of the flights are coming mostly empty. So the number of passengers who are getting off are also very few. If you can actually do a rapid screening of these passengers to see who's testing positive in through a rapid testing kit, and then reconfirm it with the kit that actually is more exhaustive and takes much longer, I think that would be the right approach to make sure that we are on top of the disease.
Absolutely. And Kiran, thank you for that suggestion, for the offer of your company to cooperate with the government. This is a time when everyone has to pitch in. And most of all, thank you for your very measured comments, because at a time like this, it's important to not panic. It's important to not spread rumors, and it's important to have solid information. It's been a pleasure talking to you. I learned a lot. Thank you very much as always, Kiran.
And I want to end by saying, please, let's not panic.
Yeah.
Let's keep our hopes alive, because I really hope this will pass in a few months.
Amen to that. Thank you very much, Kiran Mazumdar Shaw.